So in this video, we are going to discuss about a robotic surgical system. So how a robotic surgical system works and how it will help the field service engineer and a clinical application engineer and a product specialist or someone, the doctor, how it will help the surgeon to do the surgery and how it is beneficial to the patient. Okay, at the end of the any surgery, the more important is the is it really safe for the patient, or it is really helping the patient, or it is how who will be benefited by the robotic surgery. Okay, so the end goal is, because in healthcare the importance of patient is very much have to be taken care. Okay, so then we will understand about the how a robotic surgical system works and how it help the surgeon and what is the communication protocol between a robotic surgical system. Okay, so if you see the robotic surgical system, so these are from the different manufacturer from the world. They are making a robotic surgical system. This is from the intuitive surgical, this is from the intuitive surgical, this is from SS innovation, and these are from Merrill, and this is from the CMR. Okay, I've just, this video is only for the education purpose, okay, and nothing else. And there are some Chinese companies also there. Okay, the company name is Microport Medbot, and the other companies like Ace Medical and Johnson & Johnson will also come with their own robot. There are, I think, when I have started my career in robotics, so I think there are 6-7 companies. Okay, and now if you see the robotic is in boom into the market, and everyone want to be a robotic engineer. So they are basically, and the opportunity has been also increased. So in India, I think Metronics is also there. They come with the their own robot of Hugo. Their robot is like Hugo Ras. Okay, they used to say Hugo Ras. Okay, this is Metronics robot. Metronics is one of the world famous healthcare company. Okay, healthcare and their electronics company is also there, Metronics. Okay. So how a robotic surgical system look? So you have seen it. So this is called as surgeon console, and this is called as patient card, or sometimes they will call it arm card. Okay, and this is called the vision card. Okay. So every company having these three common component in every surgical system, and they will change something. So like they will someone provide their vision card with 3D monitor. So if it comes to the intuitive surgical, their vision card having a 2D. Okay, but other company like SSI providing 3D, and the Merrill also providing 3D monitor for their patient card. Okay, so this is the basic component of our robotic surgical system. So these are the component, and the surgeon console. The surgeon console will act as a master. Why it is called as master? So it is like, it is basically for the surgeon, and the who is doing the surgery? So surgeon is doing the surgery. So that's why the surgeon console is called as the master. So whatever the manipulation done on the surgeon console means, in surgery we know we are using instruments. Okay, instruments we are using. It's like instrument means what? We are surgeon are using seizure. Sometimes they are using monopolar, bipolar instrument. Sometimes they are using needle driver. Okay, so these are the common things in every surgery. So it comes to the robotic surgery also. Surgeon use the instrument. So whatever the movements done by the surgeon from the surgeon console, the same will be replicated on the robotic arm card. Okay, with the help of that instrument. Okay, so that's why this surgeon console is called as master, and this robotic arm card called as slave. Okay, you just remember these things. So that's why the robotic surgical system is called as a master slave combination. Okay. And then it comes to the 3D vision system. 3D vision system means vision card. So what is the role of vision card? So it will basically work as a communicator between the surgeon console and the patient arm card. Okay, and this will also help the assistant surgeon and the scrub nurse, those who are available during the robotic surgery. Okay, means these are basically work as a helper to the surgeon. It will help the surgeon to do the surgery. Okay, so now we will understand about the exactly how a robotic surgical system work. Okay, what is the loop between them? Okay, so we know surgeon sit here and whatever the manipulation done by the surgeon, the same will go to the patient card. Okay, patient, and after that, so whatever the patient card, the manipulation from the surgeon console goes to the patient card. But how a feedback come to the patient, or so it is exactly manipulated or not, so how it will comes, so then there is a endoscope attached to the patient arm card. Okay, so surgeon can be able to control that camera. Basically this is a camera, so this camera must be 3D in robotic surgical system. This is a benefit. So in robotic surgical system, every robotic surgical system, they use 3D camera. Okay, so because 3D, because of 3D, because the most of the surgery done by in robotic, so that are abdominal or it may be thoracic, so lower abdomen, upper abdomen, so it is inside of the patient body. Okay, we are making a port into the patient, some port of either it is from the 10 mm, 8 mm to 10 mm. Okay, 8 mm to 10 mm port. So different company having a different tocar diameter. So accordingly, according to the robot, so it will be around 8 mm to 10 mm port made into the patient body according to the target anatomy. So the place where they have to do the surgery, so they will make a port and put the camera. Okay, so with the help of camera, surgeon can be able to see the endoscopic view inside of the patient body. Okay, so first what will happen, surgeon given a some control, surgeon some do some manipulation, it will come to the patient card. Okay, now the patient card having the endoscope, with the help of visibility, surgeon have done the manipulation. Okay, and then what happened to the patient card, it is actually manipulated or not. Okay, so after that manipulation, this feedback goes to the, from surgeon done the manipulation, then patient card move. Okay, there is a movement in patient arm card, and that feedback goes to, from this patient arm card, it will goes to the vision card, and then the vision card having a control unit, the processor they have. Okay, processor they have, some company called as a control box, so it has the control box. Okay, so that control box, what they will do, so whatever the manipulation done on this patient arm card, the same will goes back to the surgeon console. Okay, it is like sometimes assistant have to remove the instrument, they have to change the instrument, they are using, maybe they are using mcs is called as the monopolar curve seizure. Okay, sometimes it is called as grasper. Okay, or the mbf monopolar maryland bipolar forcing. Okay, and then fbf is there, the instrument name is FBF. So these are some robotic instrument. So if assistant surgeon remove the instrument, clean it and insert it back, or sometimes surgeon told ki just you have to change the monopolar curve scissor with the needle driver. Okay, ND. So how this will surgeon will know? Okay, so this is a communication. Surgeon done the manipulation. The manipulation happened into the patient arm card, and it will goes to the vision card and then come back to the surgeon console. Okay, so this is a feedback loop. Okay, so accordingly the feedback it will work. This is the way of communication between the robotic surgical system. Okay, so some company will use the optical fiber between these two. So how they will do, they will connect the optical fiber, they will use one communication cable between the surgeon console to the patient card, and then the second optical fiber from the patient card to the vision card. So that will reduce the number of cables. Okay, but just because they are using the optical fiber cable, so how it will happen, we know in optical fiber cable the total internal reflection will be used. Okay, for the communication. Okay, so how it will happen, first the feedback come from here and it will go there, and again this will come from here and it will go back to them. And just because it's a communication loop communication because of optical fiber, so again it will come back here. Okay, so this is the basic principle and this is the basic of the robotic surgical system, how it will communicated with the each other. Okay, so today that's it for today. and in the next video we are going to learn about the individual surgeon console and what is the component inside of the surgeon console and the patient arm card and the vision card. So in one video I will cover one thing. Okay, thank you, thanks for watching my video.